So, my purpose of this speech is to inform my audience about the hospital setting with the coronavirus. What is coronavirus? How did it get its own name? Is coronavirus deadly? How everyone is mentioning it. Coronavirus are named for the spike that protrude from their surfaces, resembling a crown or sun's corona. COVID-19 is caused by a coronavirus called SARS-CoV-2. Other adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be a higher risk for developing more serious complications from COVID-19 illness, according to the New York Times 2020. First, I will tell you about the coworkers and this pandemic and the mercy policy. If the coworkers get exposed, we still must work until we become symptomatic and show symptoms. Then we must get tested. I personally know this because I work at the Mercy Jefferson Hospital. We wear the mask for 12 hours a day, starting when we get into the building. When we go into the patient's room, we must wear a yellow gown, a facial shield with a 95 mask if it's a high droplet, or a droplet mask if it's low droplet. Some people like to use the 95 at all times, and gloves. We can only take our mask off to switch a different mask while we're cleaning it, or go into the break room to eat. If we do have to get tested, we can get a rapid test so we can know the results in 30 minutes. And that goes for all the first responders and healthcare workers. If our test comes back positive, and then we'll have to quarantine for 14 days unless further notice. Second, I would like to talk about how the coronavirus takes over the patients. The coronavirus affects different people in different ways. We can have a 30-year-old adult get COVID and be perfectly fine and just feel like they have the flu. Or we can have a 30-year-old adult that can be sick in the hospital that has more medical problems with them, be involved, can be intubated and have 9 or more meds infusing at the same time. Therefore, we need everyone have good hygiene and good respiratory hygiene, and have everyone wear a mask if they're feeling sick or just have a cold to prevent the germs spreading to the public. I know this because my grandmother works in the ICU and TCU or other COVID rooms, so it helps to get this information. As you can see, the coronavirus does not just affect the staff, it affects everyone. In conclusion, as you can see, coronavirus affects everyone in affecting the world, making the public go crazy and scared to death if they will get COVID-19. The more steps you and your family can take to prevent the spread of the COVID-19, the safer you'll be, according to the CDC.gov.2020. Thank you.